because my children deserve better.
Because our patients need us.
Porque el hospital más cerca de aquí está a 60 millas.
Because we can do healthcare better.
Idaho is one of the most beautiful places to live, but its citizens experience healthcare differently than those in other states. Sprawling landscapes and rural and rugged terrain mean that many people live far away from healthcare facilities, forcing them to travel for hours to get to hospitals, pharmacies, and other providers. Idaho State University is the state's leader in health professions education. Students who are studying any healthcare discipline have the opportunity to improve access to care in their communities. Each year, a distinguished group of 15 students is chosen to participate in the Southeast Idaho Area Health Education Center's AHEC Scholars Program. The program collaborates with numerous partners across Idaho. Together, they provide supplemental learning opportunities so students can better experience the realities of healthcare in rural and underserved communities. AHEC scholars come from multiple disciplines and learn alongside each other. This unique interprofessional experience prepares them to work together to improve access to quality care, and scholars come away from the program with a prestigious, federally recognized certificate.
Here at Templeview, I'm the director of rehab and a physical therapist. What got me into a career in healthcare had a lot to do with growing up in a small community. I had a lot of experience with healthcare providers. That small town doctor being kind of a pillar of the community was something that appealed to me. When they presented us with, we have this new program, the AHEC Scholars, it's something that's going to better prepare you to be a rural or underserved community practitioner, I jumped at it because rural is really where I wanted to be. In rural communities, you have to know a little bit of everything. Interdisciplinary work is a huge part of what we do. I'd been introduced to it, but AHEC Scholars really pushed that a lot. It really is a group of healthcare providers from different settings, and we're coming together to kind of understand what everyone's doing. We had a woman here in our facility that when she was getting ready to go home, we presented her, we have little t-shirts that say that they've graduated rehab, and she was so excited about it and just ecstatic that she had gotten to the point that she was able to go back home. One of our AHEC Scholars classmates saw her in home health and told us that she was wearing her rehab graduate shirt, and she was so excited that she'd done it. The purpose of the AHEC Scholars, we're looking at underserved and rural communities. The reason that it's around is because these communities don't have the support they need. And there's really no downside to joining the group. All that it does is provide more opportunities, more networking, and more chances to learn.
AHEC definitely prepared me to come here and to succeed. We actually do have a lot of mental health and Spanish speaking only, and a lot of kids and elderly. So we have quite a big vulnerable population. We have to make sure that we're available for these people because the next nearest hospitals, it's quite a ways. With our AHEC program, we're able to visit methadone clinics and mental health clinics. And to this day, I am still working with my own hospital to try to get better partnerships with places that have behavioral health units or mental illness training. Overall, I get to be part of making my hospital at home a better place for healthcare.
I grew up in a rural area, and so I know how people in rural areas feel when it comes to healthcare, because we can't just go to the doctor. We have to plan a trip sometimes. And I do feel like AHEC has helped me because I understand more people's situations. And part of occupational therapy is helping them in their situation. It's been great. It's definitely helped me become a better healthcare provider, learning about all of the other struggles that people deal with on a daily basis. You know, there's a lot with mental health that goes into a person's life. There's a patient that I saw here. She struggled a lot with her depression and her confidence. And I worked with her on that in her way to where she could handle it. I was there the day that she was able to get up and go to the bathroom by herself for the first time. And she cried and I cried. I've been using what I've learned in AHEC to pass it on to other healthcare professionals. I feel like I have a head start in understanding what other medical specialties do.
I guess everything started when I fell in love with my wife. She was here and I was in Brazil, and we lived in Brazil for a little bit. But then we decided to move back to be closer to her family. When I looked into the ISU program, they had a very unique thing that's the Latino health track. You don't have to be Latino, but students that have the desire to serve the Latino community will take Spanish classes and will spend some of the clinical rotations just going and working with that population. And on top of that, I was introduced to the AHEC program, and just the opportunity to learn from other students. They're studying something that's healthcare related, but it's totally different than what I'm studying. It just aligns well with all my personal goals. I kind of fell in love with healthcare working at the American Falls Free Clinic. That has been a very great opportunity for me. Most of the population that we see there are migrant workers that are not covered by any kind of health insurance. Oftentimes they're not able to pay, or they just have a language barrier. That's their chance to get their help. It was 6 o'clock, we were closing up the clinic, and then someone walked in. She had brought dinner for us, and she was very emotional. She just wanted to express her gratitude for the service that we had provided. Her diabetes was now is under control, and her hypertension was getting better. She was exercising more. At that moment, I was really grateful to be part of that. That kind of experience you can only have when you're serving those that sometimes are overlooked. To be able to just feel the gratitude that they have, and to know that the work that I'm doing really makes a difference. You can't really put a price on that.